In today's Health Beat, today is World Autism Awareness Day, and this year's theme is employment. An estimated 80% of adults with autism are unemployed, according to the United Nations. Landmarks around the world will be lit up in blue to mark the day and show support for the group Autism Speaks. Dr. Devi is an assistant professor at New York University School of Medicine and joins us this morning to talk about some of the staggering figures we're seeing on the diagnoses of autism, right? The number of children diagnosed with the disorder has been rising for years. The latest figures estimating it occurs in 1 in 68 children. That's about 120% higher than 2002 estimates. Why is that?
Well, part of it might actually have to do with the reporting, because we've done a great job about increasing awareness of autism and autism spectrum disorders. So what's happening is probably parents and doctors, clinicians are diagnosing it more often. So that's part of it. The other thing is, because there's no actual test like a blood test or an imaging test like an X-ray to diagnose autism, then people are more likely to diagnose it based on the criteria. There are looser criteria, so it's harder for them to say.
There is this other theory I've seen out there, which is that children born to older parents have an increased risk of the disorder. In fact, there's studies that back that up as well.
Sure. So there's two parts to that. So it's true that that number does increase, that it is more often, but that only accounts for less than 5% of cases, at least according to one estimate. So we don't know why that is. We don't know if it's the age of the parents or the fact that if you're older, maybe you're more likely to be exposed to some type of toxin in the environment. Whereas if you weren't exposed to it, then your age might not make a difference.
Part of the problem, it seems like, with the autism diagnosis is there's still so few answers as to what causes it. And of course, there have been these recent concerns about vaccines and the measles outbreak that is a result of people not getting vaccines. Is there still a lot of disinformation about that connection?
True. Well, the studies are out there that show that there is no connection. So that's actually been shown. It's one of the most studied aspects of autism. But the problem is, this all goes back to one study that was published in the past in The Lancet, which is a very prominent medical journal. So the thing is, that study was published and showed that there might be a connection. Now, the problem is that the researcher that published this later was discredited. They found out he fabricated data. There was a lot involved in that.
It was completely discredited.
Exactly. But the thing is, it's sort of like the retraction that comes in fine print after you've seen the big headline, right? People didn't really all understand that, what he had published was completely false. So that was problem number one. The second thing is that, as that myth kind of took hold, then it got more traction. So now people might feel like, well, we trusted him. How do we know not to trust him anymore and to trust other people? How do we know who to believe?
When you look at autism research today, and again, the number of children that are being diagnosed with autism, where are we as far as treatment of the condition?
Well, right now the treatment focuses on the symptoms. So the issues in autism and the autism spectrum is really, it has to do with language development and social development. So these kids generally have delayed language development. They might not be babbling as soon, they might not be talking as soon. So you're really trying to focus on improving that.
And isn't it the earlier you catch it, the earlier you can mediate it?
Sure, in terms of interventions. I mean, the earlier you notice anything, you can treat autism in terms of the behavioral management, the language development, but you also want to exclude other things. I mean, if a child has frequent ear infections, let's say they can't hear, they might show some of the same problems. They might have poor eye contact, they might have some kind of repetitive movements, some fixated movements. So you really want to intervene, and you want to have the parents, the community, teachers, everybody kind of involved in helping to reorient the child.
Before I let you go, I want to change topics. The first national survey of children with attention deficit hyperactivity disorder is out, and it shows that nearly half of preschoolers are on medication for the condition instead of other recommended therapies. Is that startling?
It is startling. So part of me wonders, I mean, when we have survey data, we have to be careful. Do we have a bias in the survey? So that's number one.
Okay.
But assuming that that is true, that statistic, I mean, it's very alarming because, especially preschoolers, it's very hard to make this diagnosis of ADHD in that age group. So, these could be children that are just impulsive or a little bit, normal, so you don't want to make
But is there an over-medication concern?
Well, that's the second thing, of course. I mean, the focus is on behavioral therapy, and especially in a preschool, you need the teachers to be focusing on reorienting these kids in the behavioral therapy.
You're saying that the focus should be on behavioral therapy and not on medication?
Well, I'm not against medication, but the focus should be on behavioral therapy. I mean, medications, if you need them, of course, but at that age, we really need to focus on the therapy itself.
Dr. Devi, assistant professor at NYU School of Medicine, thank you so much for your expertise this morning.